Right. Section in the third unit. For the first section, I've already uploaded 2 videos on YouTube channel of the institute. Have you all gone through that? Anybody, please unmute yourself.
Yes, ma'am. Yes, ma'am.
Good, good. So in case you have any difficulty in understanding that, please let me know. Okay. This lecture I'm recording and I'll upload this lecture also on the YouTube. So we'll start with the lecture. So today I'm going to start the second section of the third unit, that is epidemiological and biostatistical approaches. So today we'll cover the epidemiology part, and tomorrow probably we'll cover the biostatistics part. So the title for today's lecture is Introduction to Epidemiology. So recently, these are the, I'm sure you're able to see the 3 news reports that I've pasted here. So recently, these news reports I've gathered in the last 2-3 days. They are very recent. So a news story described this one, that Mumbai's concern about the rise in the number of COVID cases as Maharashtra has become the hotspot of COVID cases in India. So around 60 to 70% of cases in India are coming from Maharashtra, COVID-19 cases. We know that India is in COVID-2 phase. That is a second wave of COVID has attacked India. Now, another story reported the revised recommendations given by the government for who should receive COVID vaccine in the coming 2 weeks. And government has recommended, it has asked all the states to vaccinate all above 45 years of age in 2 weeks in the districts that are seeing a surge in COVID-2 cases. Then the third story pasted here discuss the disease monitoring mobile health technology that can be beneficial for adults with heart disease. So this all comes under epidemiology. So what is epidemiology? We'll try and understand that today. So I'll first give you the outline of today's class. So outline of today's class is, first we'll cover the definition of epidemiology, that is, we'll learn how to define epidemiology. Then we'll come to history of epidemiology, that is, we'll try and summarize the historical evolution of epidemiology. Then in the third step, we'll come to the uses of epidemiology, that is, we will name some of the key uses of epidemiology as a science. In the fourth step, we'll identify the functions of epidemiology, that is, we try and identify the core functions of epidemiology that the science performs. And fifth and last point for today's class is the approach that epidemiologists take in trying to solve the problems. So we will try and describe the primary applications of epidemiology in public health practice and the epidemiologic approach that epidemiologists take. So we'll begin the class. So we'll start with the meaning of the term epidemiology. What do you mean by the term epidemiology? So the word epidemiology is of Greek origin. It comes from 3 Greek words. The first is epi. Epi means on or upon. If any of you have worked in a laboratory, you must have used or you must have come across a fluorescence microscope. Have you ever come across a fluorescence microscope? Any of you? Yes or no? 4 people have entered the waiting room. So a fluorescence microscope is a normal fluorescence microscope is an epifluorescence microscope, which means the fluorescent light, the incident light comes from above the specimen, falls from above the specimen. So it falls on the specimen. So epi is a Greek word or term which means on or upon. Then the second term is demos. Demos means people. And the third and the last term that epidemiology is made of is logos. We all know that logos means the study of something. So when you combine the 3 terms, it means on or upon the study of something that is on or upon the people. Now, what do we mean by on or upon? On or upon means something that has befallen the people. हम बोलते हैं ना कि सर पे मुसीबत आ गई है, तो सर पे जो आ गई है उसको पढ़ना, उसको स्टडी करना, उसका अध्ययन करना. सर पर आने का मतलब है कि कोई मुसीबत है जो ठीक नहीं है, जिसको लोग चाहते नहीं. So it means something not good. So in other words, epidemiology is the study of something that has befallen the people, or epidemiology has its roots in the study of what befalls a population. So whenever we talk of something that has befallen a population or people, it means diseases, injuries, deaths. So epidemiology in simple terms means the study of diseases, injuries, and deaths in a population. We'll later on come to the more scientific and detailed definition of epidemiology, but this would do for now. Now, let's move on to the next slide. Moving to the next slide. Right. So now we'll try and understand the definition of epidemiology. So many definitions have been proposed for epidemiology, but the following definition, this definition that I've written here, I've chosen this definition because it fully captures the underlying principles and the public health spirit of epidemiology. The simple definition of epidemiology is the study of diseases, injuries, and deaths in a population. But to understand this epidemiology as a science, we will go through this definition in detail. So this says epidemiology is the study. Now here I have emboldened certain words. So epidemiology is the study of the distribution and determinants of health-related states or events in specified populations. This is one part of definition. So epidemiology is the study of the distribution and determinants of health-related states or events in specified populations. What do we mean by this? यानी एपिडेमियोलॉजी को हिंदी में महामारी विज्ञान भी बोलते हैं. मैं बीच बीच में हिंदी भी यूज करूंगी उन लोगों के लिए जिनको तुरंत या फास्ट अंग्रेजी समझने में दिक्कत होती है. तो महामारी विज्ञान किस अध्ययन है, स्टडी मतलब अध्ययन, किस चीज का अध्ययन करता है? डिस्ट्रीब्यूशन. डिस्ट्रीब्यूशन यानी विस्तार. उस पैटर्न क्या है बीमारी का पॉपुलेशन में, किसमें स्टडी कर रहे हैं हम? स्पेसिफाइड पॉपुलेशंस में. यहाँ पर इंडिविजुअल याद रखिएगा, whenever you're talking of whenever you go to a physician, whenever you're sick, you go to, who's this? Let me admit, 2 people have entered the waiting room. Please try and be there in time because this is very disturbing. People keep on entering. So किस चीज का अध्ययन करता है महामारी विज्ञान या एपिडेमियोलॉजी? बीमारी के डिस्ट्रीब्यूशन का, कैसे फैली हुई है, पैटर्न क्या है डिस्ट्रीब्यूशन का, फ्रीक्वेंसी क्या है, यानी नंबर और पैटर्न क्या है. तो जब भी आप बीमार होते हैं, whenever you're sick and you tend to visit a physician, the physician tries to examine you. He takes your travel history, what all you've eaten, asks you about the symptoms, then notes down certain signs and examines you physically. If he or she feels necessary, it asks you to undergo certain tests, and these are the information that the physician records. So all this information and the data that physician records helps him in diagnosing what problem you are going through or what disease you're suffering. So as a physician tries to solve the problems of an individual, similarly, an epidemiologist does the same with the population. So for an epidemiologist, the patient is not an individual. For an epidemiologist, the patient is the population or the community. So what we mean by specified populations is not an individual, but the community or the population as a whole. So an epidemiologist, for the epidemiologist, the patient is not an individual. He also tries to solve the problems, the problems that a population is facing in terms of diseases, injuries, or deaths. But he tries to solve the problems of population as a whole, not of an individual. Whereas a healthcare provider or a physician or a surgeon is interested in trying to solve the problem of an individual. So this is the difference between a healthcare provider or a physician and an epidemiologist. So महामारी विज्ञान अध्ययन करता है diseases, injuries और deaths के distribution का and determines, यानी कौन से कारक हैं, कौन से factors हैं, कौन से risk factors हैं जो उस health related state या event के लिए responsible हैं. Health related यानी स्वास्थ्य संबंधी अवस्था या उस स्थिति के लिए जो जिम्मेदार है. तो ऐसे कारकों और उनके विस्तार, बीमारी के विस्तार और वो किन कारणों से होती है, इसका अध्ययन पॉपुलेशन, स्पेसिफाइड पॉपुलेशंस में करना, ये महामारी विज्ञान का काम. The second part of the definition is, it says, and the application of the study to the control of health problems. Now, epidemiology is not just a science of study or understanding the distribution or determinants of health-related states or events. After you've studied and you've come to a certain inference, then you need to apply this information or knowledge that you have gained from the study to the control of health problems that the population is facing. So epidemiology is not just the study, but it is the application of the study to the control of health problems in specified populations. This is a complete definition of epidemiology. Now here, I will explain to you in detail about each of the keywords that I have emboldened here. That is, epidemiology is the study. So what do we mean by study? Why is this word important? Then what do we mean by distribution? What do we mean by determinants? Health-related states or events, specified populations, and the application. So the key terms in this definition reflect some of the important principles of epidemiology, and hence we will try and understand them in detail. ये लेक्चर रिकॉर्ड हो रहा है, लेकिन अगर आपको कहीं पर कुछ समझ में नहीं आता है तो आप पूछ सकते हैं. सवाल छोटा रखिएगा, मैं छोटा जवाब देने की कोशिश करूंगी क्योंकि हमारे पास समय कम है. Sorry. Right. So we'll first try and cover this word, study. So what do we mean by study? Epidemiology is a scientific discipline. It has this scientific discipline has sound methods of scientific inquiry at its foundation. So a scientific discipline is any discipline which has sound methods of scientific inquiry at its foundation, which means that you can call a discipline scientific. उस किसी भी विधा को आप वैज्ञानिक विधा तब बोल सकते हैं जब उसके पास साइंटिफिक इंक्वायरी यानी वैज्ञानिक तरीके से प्रश्न पूछने के और उन प्रश्नों के जवाब प्राप्त करने के तरीके हो, मेथड्स हो, साउंड मेथड्स हो. वो मेथड्स जो रिलायबल हो, इवैल्यूएट किए जा सके और रिप्रोड्यूसिबल. ऐसे मेथड्स साइंटिफिक इंक्वायरी के लिए जिस भी विधा या जिस भी साइंस के पास, जिस भी विज्ञान के पास होते हैं, उसको हम साइंटिफिक डिसिप्लिन बोलते हैं. So epidemiology is a scientific discipline, which means it has sound methods of scientific inquiry at its foundation. It is not just a random subject. Data and information is not collected at random. There is a method. Now, it is also data driven. Now, what do we mean by data driven? Whenever you have to, देखिए, इसके पहले कि मैं और डिटेल में जाऊं, मैं आपको साफ और सरल शब्दों में बता दूं. ये आप समझ लीजिए तो आप एपिडेमियोलॉजी आपको हमेशा याद रहेगा. आम जीवन में, इन डे टू डे लाइफ, जब भी कोई समस्या आपके पास आती है, आप किसी समस्या से ग्रस्त होते हैं या समस्या परेशान कर रही होती है आपको या किसी जनसंख्या को परेशान कर रही होती है, तो हमारा पहला अप्रोच होता है कि हम उस समस्या का पहले तो हम ये पता करें कि समस्या है. चैट में क्या बोल रहे हैं? पहले तो हम ये पता करें कि समस्या है क्या. जब हमें ये ज्ञात हो जाए कि समस्या क्या है, तो हम उस समस्या के कारण को ढूंढने की कोशिश करते हैं कि समस्या का कारण क्या है. समस्या का कारण पता चल जाने पर हम उस कारण को दूर करने की कोशिश करते हैं, यानी समस्या का समाधान प्राप्त करने की कोशिश करते हैं. समाधान या तो समस्या के कारण को दूर करके किया जा सकता है या फिर उस कारण को कुछ समय के लिए उससे बचने की कोशिश करके किया जा सकता है। या तो आप उसको प्रिवेंट कर सकते हैं या आप उसको कंट्रोल कर सकते हैं। तो समस्या का समाधान ढूंढने की कोशिश करते हैं। एक बार हमें समाधान प्राप्त हो गया तो उस समाधान को पॉपुलेशन लेवल पर, क्योंकि एक एपिडेमियोलॉजी का कर्तव्य है पॉपुलेशन, उसके लिए पेशेंट इंडिविजुअल नहीं है, जनसंख्या है, पॉपुलेशन, तो उस समाधान को पॉपुलेशन लेवल पर यानी जनसंख्या के स्तर पर कैसे इम्प्लीमेंट किया जाए, इसके लिए पॉलिसी बनानी होती है, नीति बनानी होती है, और नीति बनाने के बाद उस नीति को जनसंख्या के लेवल पर इम्प्लीमेंट करना होता है। तो ये 5 स्टेप्स होते हैं एपिडेमियोलॉजी में, दैट इज trying to find out what is the problem, figure out what is the problem, then the cause of the problem, which is the determinants of the problem. Here the problem is the health related states or events. Then in the third step, trying to find the solution to the problem. Once you sort out the cause of the problem, you're trying to sort a solution to the problem. Once you've gotten a clue to the solution of the problem, then you need to make policies to implement that solution at the population level. And once you are ready with the policy to implement that solution at the population level, you now have to implement that solution at the population level. So that is how you will get rid of the problem, that is the health related state or event that is boggling the population. So study means epidemiology is a scientific discipline with sound methods of scientific inquiry. It is data driven. So whenever a population is facing a problem, for example, in the present COVID-19 pandemic situation, this is a health related state or event, a pandemic. The first step that an epidemiologist would take is that he or she would go and collect data. How many people? There are 4 basic questions that an epidemiologist needs to ask in the first step. How many people are sick? Kitne log bimar hain? Who is sick? Which means which segment of the population is sick? Old, young, children, rich, poor, females, males. So which segment of the population is sick? Which means, is there a pattern to this disease or not? Who is more vulnerable to this disease? Then the third question they ask is, where, kahan gaye the ye log? Kahan par inka exposure hua source of infections? So where have they traveled, if they have traveled at all, or where did they get exposed to the cause of this disease? Then the fourth question they ask is when. यानी बीमारी के लक्षणों की शुरुआत कब हुई और पहला केस, इंडेक्स केस कब आया, और उसके बाद बीमारी पॉपुलेशन में कैसे फैली. तो कितने लोग, हाउ मेनी पीपल, हु इज सिक, कौन सिक है, कौन बीमार है, where and when, how many, who, where and when. These are the 4 basic questions that an epidemiologist asks in the first step. These 4 basic questions are the core of descriptive epidemiology. So epidemiology is a data-driven science and it relies on a systematic and unbiased approach. Systematic means it has certain steps and methods that one has to follow if you are practicing epidemiology as a science. Unbiased means you do not have to put in your perspective or what you tend to think in the study. You have to be unbiased. You have to note down data as and when and how it occurs. You do not have to put in your perspective into the data or the study. So it is an unbiased approach. It consists of 3 steps. First step in epidemiology is data collection. You collect the data. The second step in epidemiology is analysis of the data. So you analyze the data. And the third step in epidemiology is of interpretation of data. Now, once you've collected the data, you've analyzed the data, Now what you need to do is interpret that data and come to a logical conclusion or inference. So the basic epidemiologic methods जो कि यूज किए जाते हैं day-to-day practice of epidemiology में, they tend to rely on two things. First is careful observation, यानी आपको बहुत careful और सूक्ष्म निरीक्षण करना है, अच्छे से observe करना. और second चीज जो जरूरी होती है, which is a part of the basic epidemiologic methods that epidemiologists use in their day-to-day practice, is that they use valid comparison groups. So observation helps in the collection of data. Careful observation helps in the proper collection of data, and valid comparison groups helps the epidemiologist in analyzing the data well. So जब भी आप मान लीजिए हम present COVID-19 situation से समझने की इसको कोशिश करते हैं, तो epidemiologist, Indian epidemiologist, or let's assume that the government of India has adopted the role of an epidemiologist in this case. So many epidemiologists are working hand in hand with the government of India right now to control the situation. Not only in India, all over the world, epidemiologists are working hand in hand with their governments. So let us assume that for time being, Indian government has itself adopted the role of an epidemiologist. So the epidemiologist is trying to collect information, how many people are sick. So if you are having symptoms of COVID-19, then you need to go to the doctor, inform the authorities and get yourself tested. And similarly, if the test result comes positive, then you have to, whatever directions government has given for COVID-19 positive people, you have to follow that. And if you are not COVID positive, then you need to take certain precautions as general public to prevent your exposure to COVID-19 as far as possible. So data is being collected for how many people are sick. Then once you know that how many people are sick, or this is a surveillance going on, so on a routine basis, the number of cases are being looked at. The number of cases are being added onto the existing data, number of deaths, the number of recovered cases, everything is being surveillance. So once you know how many people are sick, then the next question the epidemiologist, in this case, Government of India, asks is, who is sick? So they came to know that this disease affects the older population or people with comorbidities more as compared to the rest of the population. So that segment of the population has to be more careful with respect to this disease. Then because this is an infectious disease and it came to India, so we are running out of time, only 10 minutes left. So now I'll hurry up. So the basic epidemiologic methods, they tend to rely on two things. First is careful observation, and the second is use of valid comparison groups. Use of valid comparison groups means that you have to compare between a disease, a group of people who are suffering with the disease and a group of people who are not suffering with the disease to come to a certain conclusion, to assess whether what was observed, it differs from what might be expected. For example, let us say that the number of cases of a disease in a particular area during a particular time period is 2,000, whereas what the government or the epidemiologist had expected to be 200. So this is a huge difference, 200 versus 2,000, or the frequency of an exposure among persons with disease. So if you are not getting results as you had expected, then you need to analyze why this difference, making use of valid comparison groups. We'll understand this in detail in the later classes. So epidemiology is often described as the basic science of public health, and there are two good reasons for that. The first reason is that epidemiology is a quantitative discipline. That is, you need to collect data, numerical data, as well as categorical data. You need to analyze that data and you need to interpret that data. So it is a quantitative discipline and it makes use of three fields for its analysis, for the collection, analysis, and interpretation of data. The first field is that of probability. So you need to be an expert in probability to be a good epidemiologist. The second field that it makes use of is, or it draws methods from it, is statistics. So you need to have a good knowledge of statistics to be a good epidemiologist, and you need to be well versed with research methods. So these are the three fields that epidemiology draws from, that is probability, statistics, and research methods, because it is a quantitative discipline. Now, the second thing that makes it the basic science of public health is, the second reason for that is that it is based on a method of reasoning on developing hypotheses. So it is a method of reasoning on developing hypotheses. So once you collected data, that is, once the descriptive epidemiology part is over, how many, who, where, and when you have collected data regarding this, then you need to analyze that data. You need to come up with a hypothesis, which means what a hypothesis which says what it might be the cause for this problem. You know how many people are sick, you know who is sick, you know where did they travel or where did they get exposed to the disease, or the causative agent or the risk factor to the disease. And the fourth is when did the symptoms of the disease start, or when did the first index case came up. So once you've gotten all this data, you need to develop a hypothesis about what might be the cause or the risk factor responsible for this disease. And to do that, once you've developed a hypothesis, you need to test that hypothesis. And the same method is applied in biology, behavioral sciences, physics, and ergonomics. So it is a method of reasoning on developing hypotheses, and it develops hypotheses in all of these related fields. That is, it makes use of biology, behavioral sciences, physics. Public health physics is also a developing branch. Public health engineering is a well-developed branch, and ergonomics too. And it makes use of all these sciences to explain health-related behaviors, states, and events. Now, we'll draw a corollary with journalism to understand what epidemiology is and what is an epidemiology supposed to be. तो आपको ये पता है कि जर्नलिज्म के स्टूडेंट्स को ये सिखाया जाता है कि एक अच्छी न्यूज स्टोरी क्या होती है. तो एक अच्छी न्यूज स्टोरी के लिए उनको 5 टर्म्स, 5 W सिखाए जाते हैं. You need to be aware of the 5 W's if you want to be a good journalist. एक अच्छी न्यूज स्टोरी अगर आपको बनानी है, कवर करनी है, तो उसके लिए क्या क्या इंफॉर्मेशन आपको कलेक्ट करनी है. तो ये सिंपल सूत्र उनको दिया जाता है कि आपको 5 W's कलेक्ट करने हैं या इनको याद रखना. The first W is what, second is who, third is where, fourth is when, and the last is why. So why can sometimes be treated as how also. So what, who, where, when, and why or how. तो ये सारे क्वेश्चंस अगर आपने पूछे हैं तो आप एक अच्छी न्यूज स्टोरी बना रहे हैं या कवर कर रहे हैं या प्रेजेंट कर सकते हैं. ऐसा जर्नलिज्म में स्टूडेंट्स को सिखाया जाता है. यही चीज एपिडेमियोलॉजिक इवेंट्स के लिए भी सही है, एग्जैक्टली ट्रू है. या अगर फॉर एग्जांपल whether it is an outbreak of coronavirus in India, or whether you want to study the use of mammograms to detect early breast cancer in women, you need to ask the same 5 W's. बस इनका context या perspective बदल जाता है. Difference क्या हो जाता है? So the difference is that epidemiologists also ask the same 5 W's. So the synonyms for these 5 W's that are used in journalism is, पहला what का मतलब हो जाता है what is being diagnosed or what is the health event in question. दूसरा, for example, अगर COVID-19 pandemic का हम example लेते हैं तो what is the COVID-19 case or COVID-19 pandemic. The second is W is who, यानी कौन जर्नलिज्म में किसके साथ हादसा हुआ है या कौन पीड़ित है. एपिडेमियोलॉजी में कौन पीड़ित है बीमारी से या कौन बीमार है, तो इस केस में पर्सन, हमें ये पता है कि ओल्डर पॉपुलेशन यानी पीपल अबव 60 or people with comorbidities are more vulnerable to this disease. So the third W is where, yani where did they get exposed to the cause or the causative agent of this disease or the risk factor that increase the probability for this disease. Fourth is when, that is time. So when did they get exposed to the causative agent or the risk factor, and when did the symptoms start, when did the disease enter the second phase or the third phase or the community transmission phase. So when qualifies for time. Then the last W is why, or sometimes it is also changed to how. So an epidemiologist asks why means why did the disease occur? So what is the cause of the disease? Or why did the disease occur? What are the risk factors for the disease? Why did the disease occur? So, or how did the disease occur? So what is the mode of transmission of the disease? So these are the 5 W's that an epidemiologist asks. So what stands for diagnosis or health event? Who stands for person? Where stands for place? When stands for time? And why or how stands for causes, risk factors, and modes of transmission. So only 1 minute is left. Then we'll come to the second term, that is distribution. So distribution is concerned with 2 terms, that is frequency and the pattern of health events in a population. So what do we mean by frequency? Somebody is creating disturbance. Please mute yourself, everybody. So frequency refers to the number of health events. Number of health events means the number of cases, like number of cases of COVID-19 in a population, number of cases of COVID-19 in Lucknow district or Lucknow city. Not only does it refer to the number of health events, such as number of cases of a particular disease, but it also refers to the relationship of that number to the size of the population. यानी अगर न्यूज में आप ये सुनते हैं कि लखनऊ शहर में कल, ये तो सच ही है, लखनऊ शहर में कल के दिन 1000 से ज्यादा कोविड-19 के केसेस आए, ये मैं आपको न्यूज बता रही हूँ जो कि सच है। तो कल लखनऊ में 1000 से ज्यादा कोविड-19 के पॉजिटिव केस पाए गए जांच करने पर। ये 1000 से ज्यादा कोविड-19 के पॉजिटिव केस पाए गए, तो न्यूज में सवाल था कि क्या लखनऊ उत्तर प्रदेश का नया हॉटस्पॉट बन गया है कोविड-19 के लिए। लेकिन ये जानकारी, नंबर्स जो आपको बता रहे, ये अधूरी है जब तक आपने डिनोमिनेटर